Okay, now we like to open up, we're coming to the second segmentation, and I like to open the forum to Dr. T.C.Poornima from India, Deputy Director, Minister of Information and Broadcasting, Government of India, Mysore, and News Bureau Chief in All India Radio, News Editor, Doordarshan, Kendra, Bangalore. We are very honored, Madam, you are being here. We like to give it to the, now the forum is for you to address.
Thank you very much, Mr. Barry. Good morning, everybody. I thank the organizers, AMCA and our comrade Sri Madan Gowda, for giving this opportunity to address you all on the topic of role of media during the ongoing pandemic situation with regard to Indian context. In my opinion, Indian mainstream media did not back out in its role as a main source of information. It did definitely play a very vital role in giving essential directions to the society to withhold or overcome the crisis of the pathogen. But we also have to look into the other factors affected the citizens in getting the information or getting misled by the information through these media. Not only media, even hearsay information, malinformation, rumors, and fake news. This is where the valuable work of our media became arguable too in India. Briefly, let's recollect that the coronavirus is supposed to be the biggest of the sort the world had ever seen in the recent past. This novel one, in the name of SARS-CoV-2 virus, emerged in the last leg of 2019, leading to an unforeseen health crisis at the global level. The disease caused as coronavirus was named by WHO as COVID-19. Of course, the wildfire spread of the infection was a source of public concern and anxiety, as nothing was known about this particular virus, its novelty, its notoriety, pathway, and footsteps, inference, and its results. Hence, this new pathogen certainly created a state of havoc and panic across the world. The outrage of disease and death led to deep dark mark on social, economic, cultural, and racial issues, apart from that of mental and emotional stress and trauma. This is the point where the media action became substantially essential. With the backdrop of the spreading coronavirus, there came geographical lockdowns followed by extended quarantines. Trade and financial activities reached its low, leaving the society to hardship. A fractured livelihood that could have led to starvation and death on one side, and the non-treatable coronavirus created threat of life, suffering, ailment, and death, and on the other side. This is the point exactly where the media action became substantially essential. People were to be given to understand about what this virus was, how it attacked, its spreading wave pattern, how to prevent it, safety measures, appropriate behavior, struggle for life, or even to the extent of disposing the mortal remains appropriately. Other than media, especially electronic media, there was no other larger means of outreach and communication system. Here is where our Indian media played its level best and tried to educate the countryman. How media supported the health sector and the governments in this awareness process. Let us look into that. Point one, create awareness on virus COVID appropriate behavior like hand wash, use of sanitizer, mask, and personal distancing. All these were not known to our people earlier. This was a great support in the media, as the media could reach out to a large population at once and inform them to conduct themselves. We were not ready with the proper infrastructure for the health hazard that was going to hit us in this magnitude. Point number two, locating, tracing, and tracking the spread of virus disease was supported by media and update from time to time through live update dashboards. This supported the health, police, administration sector, and frontline workers in their job. Still, it was not an easy affair for them to contain, control, and prevent the huge population from the deadly virus and keep people under protection. Point number three, Media published illness preventing guidelines regularly and maintained privacy of the patients too specifically. This was giving an update information on positive cases, recovered cases, uncontrolled cases, with which public could get a picture of the gravity of the disease and took to care themselves appropriately. Point number four, media encouraged people to use telehealth services to cater their health care. Of course, as you all know, the lockdown and the personal social distancing mattered much during the pandemic situation. Virtual activities were encouraged and applied in every segment, which was true in case of health also. People could get their medical aid virtually. This was thoroughly publicized by media. Point number five, media condemned the unscientific methods of medical aid by quack medical practitioners and curb unverified medicines. Those would be harmful to the people. There came a number of uncertified medicines and fake doctors to light during this period, misleading the innocent public, which were condemned totally by media. They were brought to light and they were even punished. Media put forth the communications in front of the public issued by authorities, authorized institutions like government departments, disease control and prevention centers, World Health Organization, and so on, to enable rapid outreach of information on public health. More importantly, to mention about the government television network and the Prasara Bharati found more cool, calm, and too appropriate in placing the information in a right sense. Across the country, the vernacular government channels maintained accuracy and credibility without exaggerating or sensationalizing news, creating confusion in the minds of people. Media effort in creating awareness or educating the unorganized, undereducated region of the country was far more challenging than simply disseminating routine information, as the information provided with regard to the unforeseen pandemic was being read with a negative intonation. This was basically due to the sudden emergence of the virus, unpreparedness to face it, low of educational standards, economic status, and also few psychological factors. As the spread of coronavirus was unexpected and rampant, it took some time for people to open their eyes and see the wave. Media did play an important role here at this point of time by spreading the relevant information or disseminating the information on the virus, its spread, and its deadliness. Mentality of a section of people was not ready to accept the reality. Their carelessness yielded wrong results. Media had to use a harsher language to make people understand the impact of the virus attack. In this in turn created fear, stress, and psychological trauma among people. Here, I would like to place an example of Tablighi Jamaat in Delhi, that is in Nizamuddin Delhi. Later, this attracted the observation of the Honorable Supreme Court upon few specific television channels too, particularly in Kannada, in Karnataka state. No doubt that the media brought the threat of a spread of virus by Tablighi group of people to light, but the undertone of the channels was totally different. They looked at the innocent ones as culprits. Even few journalists went up to the level of calling them bioweapons. The language used to explain them was abusive and harsh. This attitude of the TV channels lowered their trust and their credibility at large. As everyone knows that India is densely populated over 130 crores of people and 72% of them reside in rural India. Media accessibility to rural viewers is only 22% according to surveys. Denying access for information, outreach is as poor as that. Okay, friends, in this situation, in spite of these observations, the mass media has an imperative role in today's world and it can provide a unified platform for all public health communications, comprehensive healthcare education guidelines, and robust social distancing strategies while still maintaining social connectivity. It can enable equal access to healthcare, end discrimination, and social stigmatization. The role of media and public health communications must be understood and explored further as they will be an essential tool for combating COVID 19 and future outbreaks. With this, I thank one and all here for listening to me and AMCA specifically. Thank you, sir.
Both Shukya and Madam, I think it is indeed a great learning. Thank you so much for joining us today. Especially it's a great honor for AMCA and all the Sri Lankans are concerned, and also all the Asia region is concerned. We are very much valued your point, and also safety measures are very important. How media can support the health sector and the government and create awareness, stop the spread, up-to-date proper information, time to time, something what you mentioned, which is very, very important at today's context. Also for your kind information, ma'am, we will be taking these notes. We are recording all your speeches. So we will be taking these notes very much in consideration, and hopefully very soon we will be put out a booklet where all these learnings of today's discussion will be published and hand it over to AMCA with the initiative of our President Rupal Janaka Jaising and Pratham Vikram of the Secretary of the organization. I once again, I thank you very much for joining us today with your very, very busy schedule, I know.